Hi, welcome, and thanks for joining us for Ask the Expert, a live virtual chat with Dr. Vin Gupta to discuss asthma, flu, and COVID-19. My name is Kafi Drexel Brown. I'm the Public Relations Director with the Asthma and Allergy Foundation of America, also known as AFA. This week is National Flu Vaccine Week, and that's what's bringing us together. So during this webinar, we'll talk about why it's so important for people with asthma to sleeve up and get flu shots. But we'll also discuss managing asthma during the COVID-19 pandemic and what we should know about the new vaccines. This session is being recorded and may be distributed in whole or in parts following this live event. Now, before we dive into Q&A, a bit of housekeeping. Attendees are in listen-only mode. Some questions have been already submitted by you, the audience, during registration for this event. But please feel free to further interact by submitting general questions and comments. You can do that by typing in the chat. We'll also try to answer as many questions during this session as possible. We can only cover topics of a general nature. The information presented today is not personal medical advice, and we encourage everyone to consult with their doctors as needed. Now, throughout the event, we will share resources that we believe you will find helpful in both the slides and the chat. As I mentioned before, I'm joined by Dr. Vin Gupta, and we're so excited to have him here for this discussion. Dr. Gupta is a critical care pulmonologist and an affiliate assistant professor at the University of Washington's Institute for Health Metrics and Evaluation. Not only has he been a guidepost for his patients and students, but for millions of Americans throughout the COVID-19 pandemic. You can see him regularly on both NBC and MSNBC as a medical contributor, and he is also a major in the Air Force Reserve Medical Service Corps. His military background includes pandemic preparedness around the globe. He's also a dad and a husband, and so taking all of that in, thank you, Dr. Gupta, for taking the time during your extremely demanding schedule to chat with AFA and our community.
Oh, thank you so much, Kafi, for having me. It's really a pleasure to be here.
I mean, you're a superstar already in this discussion because you got my name right off the bat. So thanks for that. So, okay, so considering this is National Flu Vaccine Week, let's start off by talking about asthma and the flu. Dr. Gupta, can you talk about when the typical flu season starts and ends and what we might expect this year? Is there anything new you're observing about the flu season so far? And what kind of patterns around flu are we seeing during the COVID-19 pandemic?
Yeah, absolutely. Extremely important questions in any year, especially this year where we have a respiratory pandemic on top of the usual concerns about influenza. Here's what any asthmatic, the asthmatics I care for, I think should know. And a lot of this you might have already heard. So hopefully none of this is truly new information. But we do expect that early cases of flu happen as potentially first week of October, which is why there was some push. There wasn't consensus on this, but certainly some individuals in public health, I was one of them, felt that potentially get your flu shot as early as middle to late September, soon after it was actually widely available, with the thought being that maybe we would see differential patterns in transmission and an earlier start to the season. Usually, you don't really see the flu season really pick up until the middle to later parts of November, and then it really starts peaking December, January, February, and then starts to sort of slow down March, and then rarely into April. And so it's that sort of 4 to 5 month window, dead of winter, where we typically see the worst flu cases. There's a few qualifiers this year, and I don't want anybody I want everybody to keep their guard up. But the simple fact here is that by all the mitigation measures that we've been begging people to employ for COVID-19, so masking, hand hygiene, frankly, staying at home in all but emergent cases if you can, that forecasts expect that if those things continue, they'll hopefully mean good things when it comes to flu. That if people get vaccinated for flu, and if we do all the things we should be doing to minimize transmission of COVID-19, then even though COVID-19 is its own tricky pandemic because it transmits itself in different ways from flu, that hopefully that means that maybe we'll be in for a little bit of a reprieve in terms of a less severe flu season. We can only hope, but that's what our modelers and our forecasters at IHME and other institutions are hoping to see. It does not, let me be clear, mean that we should be taking any of these things lightly. It means a single-minded focus on prevention. Flu vaccines any year are a good idea, are a phenomenal idea, not just a good idea. This year more than any. I've cared for patients. I'm actually going right after this panel to help my colleagues in the intensive care unit, and we've cared for in the last few weeks patients who've been co-infected with flu and COVID-19, and they don't do well. And so there's flu and COVID-19 are unsparing diseases, and they require vigilance. But with flu, we can control things more than we can control things with COVID-19. We have a vaccine. We actually have a therapeutic that, if given early enough after diagnosis, Tamiflu, we think might actually lessen the severity of illness. So there's things we can do to at least minimize the impact of influenza. And I'm hoping that, given how terrible COVID-19 is in these coming months and how bad we think it may this pandemic might get before the vaccine really is distributed, I'm hoping that means that everything that we're doing for COVID-19 is going to give some positive externalities for flu.
Yeah, at AFA, the staff have been sharing their experiences about getting the flu shot. I shared mine, and you might see me popping up in the slide below too. And we've been asking people to join us and share a hashtag sleeve up and a hashtag fight flu pictures on social media to encourage everyone to get their shots. So Dr. Gupta, why is it so important that people with asthma get vaccinated and protect themselves from flu? And why is flu such a risk for people with asthma?
Absolutely. So asthma is one of the primary, one of the most common chronic lung diseases in the world. And the ways in which we treat asthma, inhaled steroids, other inhaled medications. In some cases, if you have really severe asthma, so maybe your pulmonologist or your doctor, your provider might even give you oral steroids to help manage exacerbations, so you don't actually have to come into the emergency room. I've had to do that for many patients that I've cared for over the years. What does that mean? A chronic disease that's common and medications that have significant side effects in some cases. It means that you're vulnerable. It means that your immune system is not as strong, unfortunately, given the fact that you have a chronic lung disease like asthma, and that those medications can actually also predispose to infection. So it is vital that, because of the way in which we manage asthma, because asthma in and of itself weakens your lung defenses, your airways are not, unfortunately, as resilient with asthma than without asthma. That it's number one, it's extremely important to make sure your asthma is as under control as possible, that you're frequently engaged with your clinical providers, that your asthma control questionnaire or whatever way you're monitoring your asthma control, that you're keeping a close eye on what that on how your symptom profile is, on how your quality of life is. So that's number one, make sure your asthma is in good control. And then number two, it's vitally important to control what we can control. Infections like flu prey on people, and I want to be direct here. They prey on the vulnerable, and and I don't want to make anybody feel like they're weak or they're vulnerable or that they can't they're not empowered to control their own health. That's not the point of what I'm trying to say. But what I am saying is that viruses like influenza, COVID-19, increasingly impact those people with chronic diseases like asthma. So it's vital that interventions like the flu vaccine are adopted by by asthmatics, regardless if you have a mild profile or if you have a severe profile. It's absolutely vital, because I will say this: the people that I care for in the ICU who require advanced interventions, who require a long stay with me. You don't want to see somebody like me many days in a row in an ICU. You just don't want to do that. They're generally people with chronic lung diseases or chronic heart diseases because their immune system defenses are by definition weaker. They're lower than if you didn't have one of those conditions. So it's absolutely vital to get the flu vaccine.
Got it. So you can see here in this next slide that there are several flu vaccine options. And can you talk about what these different options mean and who should get vaccinated?
So there is I guess this gets complicated quickly. What I would recommend here is let me focus on high dose versus say the nasal spray, because I think those are some of the common questions I get. Rarely do you get some of these other, at least in my experience here, generally the questions I get are, hey doc, should I get the high dose flu shot? Or hey doc, what about the nasal spray versus the shot in the arm? This is what I'll say. The high dose flu vaccine is, sometimes we think it's the right type of flu shot if you're older. So if you're over, say, 55, 60 years old, if I have a patient that's over 55, not over 65, I would recommend in most cases that they consider getting the high dose flu shot, because we think that that will cause their immune system to rev up a little bit more and ensure that they have a strong response, that they produce the same amount of antibodies that someone who's younger, who might get the low dose flu shot, would produce. So you need that high dose to ensure you get that right immune response, that right production of antibodies. So if you're older, or if you have by definition, if you're an asthmatic, your pulmonologist or your lung doc might consider the high dose flu vaccine as well, just to make sure that you have that strong response, because again, your immune system defenses are a little lower than they would otherwise be. So that's one. I get the question sometimes about the nasal spray versus the flu shot. The flu vaccine typically is made using what we call it's a vectored virus a vaccine, meaning that the virus is built on the way the weakened flu virus is injected into the body, so that your immune system recognizes it and starts producing antibodies towards it, is that it's actually inserted into another virus. And then that's not live, it's attenuated, is the sort of the technical jargon. And then it's inserted into the body. And then after a period of time, we think at least a few weeks, you have antibodies developed to that flu virus, whatever's circulating in the environment. Sometimes people think, well, if you have this live attenuated virus going into your body, is there a risk for you to get sick from the flu shot? And is there any chance that that might happen? Or could you get an allergic response to the flu vaccine? Because there's other ingredients in the vaccine that sometimes people worry might cause some sort of adverse reaction. The answer to all those questions, and so that's the concern sometimes people will pose to me, well, hey doc, is this gonna cause me to get the flu? Should I get something that maybe is perceived to be less potent but more safe, like the nasal spray? I have personally never once prescribed the nasal spray, ever, for a patient. I've always gone straight for the injection. And typically speaking, it's either the standard dosing for somebody with no pre-existing illnesses who doesn't meet an age cutoff, at least in my view, in my practice, or the high dose for the groups that I mentioned. The nasal spray, I have had, frankly, just it's not been something I've reached for. And the reason why here is I don't view the flu vaccine as something that is fundamentally unsafe. It's well tested. And we know that this platform, this live attenuated vaccine platform and delivery mechanism is safe, that there's not a risk for you to acquire the flu virus through this vaccine platform. It's just not possible. And adverse events, while they happen, like fatigue, fever, maybe some injection site redness, are not super typical. So that's generally how I would think about it, high versus standard dosing, just to keep things relatively straightforward. And I tend to avoid the nasal spray.
Yeah, I know that when we went to get the flu shot in my household, my mom got the high dose over the age of 70, and I got the standard. So that that makes sense. So want to move on to, years ago, it was thought that egg allergy was a contraindication to get a flu vaccine, but numerous studies have shown that the amount of egg protein in the vaccines is so small that it doesn't trigger severe allergic reactions. And a recent CDC study showed that the risk of having a severe allergic reaction to a flu shot is 1 in a million. Based on this and many other research studies, numerous groups, including AFA, the American Academy of Pediatrics, the American Academy of Allergy, Asthma, and Immunology, and the CDC recommend that people with egg allergy go ahead and get a flu vaccine. But there's still some conflicting information out there. And when you see a vaccine waiver form, you still see that question asked sometimes if you have an egg allergy, and these forms have that information. And that might make some people uncomfortable with getting a flu vaccine or the nasal spray. So Dr. Gupta, can you talk about the egg-free options or other information that may help people feel more comfortable with getting vaccinated? I know you kind of touched on this.
Well, I guess my response to that, Kafi, is to cite back the literature that you mentioned, which is to say that I've had my entire patient panel and those of my colleagues, when people do endorse some type of egg allergy or a related food allergy, they'll flag it. But typically what we do is just engage in reassurance, just like what you're hearing now with the COVID-19 vaccines and this report of some serious allergic events. The notion, this idea that there's some similar ingredients that could cause, that if you have an egg allergy, that somehow those ingredients, similar proteins that then do exist in the flu shot, can engender some sort of similar response. It just doesn't bear itself out in the data. So what I would recommend is that people feel reassured that any type of allergic event that's serious is highly unusual and rare. I've never recommended somebody get the egg-free or the ingredients that are similar, sort of to get the flu shot that is not constituted with those similar types of ingredients that are egg-free. Because I personally have not felt the need. I've never cared for a patient in which they've had a serious adverse event if they've endorsed a flu shot or an egg allergy rather. So I think we need to keep in mind the numbers and that these are highly unusual and very rare events. What I would say, and this is what we're going to be hearing more probably on Sunday into Monday about the COVID-19 shot, and I do think this applies to anybody with a history of a severe adverse allergic event to something, that if you have a severe allergy to anything, that typically speaking, I would probably recommend, this is a sort of off-label advice here, but I would probably recommend that if you are somebody who carries an EpiPen or an adrenaline shot.
Hello? Did we lose you?
There's somebody that probably should be getting any type of vaccine. Oh.
We missed the last part of what you said there, Dr. Gupta, about the off-label advice.
Oh yeah, the off-label advice here would be that somebody with severe allergic event to anything, whether it's egg or anything, should be getting vaccines in a place where there's the ability to provide medical care. So this is to say that I tell my loved ones and my patients, if you've had that history, and this will apply, I'm almost positive, to COVID-19 vaccines, this will definitely apply to this. And I think we should take this forward, that if you've had that type of response to any type of food or medication, you should probably be getting your vaccines, any type of them, in a monitored setting where there's the ability to provide emergency medical care on site. So if that's you watching this right now, don't get your flu shot at a Costco or a Kroger's. Don't get your COVID-19 shot at a Costco or a Kroger's or a CVS. Get it in your doctor's office. Go somewhere where there's the ability to provide medical care, because allergic responses are uncertain. they're highly unusual. They can come on very unexpectedly. But let me be clear here that nobody that I've cared for, nor my colleagues have cared for, nor the guidelines from the CDC suggest that if you have an egg allergy, you shouldn't get the flu vaccine that's built with similar ingredients that are seen with egg protein. It's just not something that I think the data bears out on, and it's not a concern that I would share. So I would not counsel anybody to not get that type of flu shot.
Yeah, and for those who don't have Costco or Kroger's around them or know what that is, Dr. Gupta means a supermarket or a drugstore. Right?
Yeah, sorry. Yes,
Yeah.
the supermarket or drugstore. Yes, of course.
Yeah, definitely. So on the topic of what might keep some people from getting flu shots, we do have a question from Michelle, or it could be Mikkel in Montreal, I don't want to get that wrong, who wants to know, and you kind of alluded to this also and mentioned it earlier as well, if we are all or should be distancing, reducing time in public, or wearing masks, etc., is the risk of catching flu also greatly reduced? And if so, why is it necessary to get a flu shot? And then we also have a question from Rosa, an asthma educator in California, who asks, many of our patients tell us that they never got sick until they got a flu vaccine, and that this is the reason they don't get the vaccine again. What are your thoughts on this, and how do you assure patients who have concerns like this?
So responding to the first question, I guess let me be clear that we are expecting that the upcoming flu season is hopefully going to be not as severe as prior, in part because everybody is also going to be getting a flu shot. That mitigation efforts like masking, distancing, staying at home when at all possible are part of that equation. But the other part is that each of us as individuals, whether or not you have asthma or an underlying allergy, that each of us is getting the things that we know that we should be typically getting every single year, like the annual flu shot, to protect ourselves. That's what these models and these forecasts are built on, that common things being common, preventive measures are being adopted. So I would not, this is the part here where we can easily falsely reassure ourselves that because we're staying at home, because we're masking, we're protected. The fact here is that any respiratory virus can find a way. That is clear. COVID-19 finds a way because it transmits itself even amongst those that are asymptomatic. With influenza, that's less of a feature of influenza transmission. Usually you're sick, and when you're sick, you're infectious to others. But the asymptomatic transmission piece is less of a driver of flu transmission. That does not mean, though, that fundamentally there's uncertainty when it comes to respiratory virus transmission, whether it's influenza, whether it's COVID-19, and you do not know if the person next to you in the grocery store market or when you're running other essential errands is sick. You just don't know that. They may look ill, but you just don't know. So you have to guard against uncertainty. That's the big thing here. And guarding against uncertainty means getting the flu vaccine. And anybody that's saying, oh, well, this flu season is not going to be that bad, why do we have to get the flu shot? Those people are saying that this flu season is going to hopefully be less severe. They're building in the assumption that you are actually getting the flu vaccine. So it's absolutely vital. It's absolutely vital. Number two, on the, I think the second question, I didn't have a chance to touch on.
An asthma educator who has a lot of patients who say they hadn't gotten sick until they got a flu vaccine, and then they got sick, so they don't want to do it again.
I think it's important to recognize that the flu vaccine built on the existing platform, I want some technical jargon, I don't want to confuse anybody. The flu vaccine, at bottom line, does not cause flu. It absolutely does not cause flu. Can it cause some mild adverse events like injection site redness, maybe some muscle aches and a low-grade temp in the first few days after you get it? Yeah, I've experienced that, but that's not flu. It's very, very different from flu. So I think it's important to keep that in mind. And let me be clear, what are the benefits of the flu vaccine? The benefits of the flu vaccine is that it's actually quite effective in preventing flu, infection with flu. That's one. And if you happen to be one of those unfortunate few who do get flu, we know that the flu vaccine actually helps minimize the severity of that illness. So there's a benefit to all of us in getting the flu shot. It's going to be effective for the vast majority. And if you do happen to get the flu vaccine, the flu virus, even in spite of getting vaccinated, we know from countless studies that the severity of your illness is going to be dramatically less.
Yeah. And people also have to understand what you mean by that is that, you know, a lot of people actually don't realize that the flu vaccine is not 100% protective. It's a percentage protective, and you can still possibly get the flu, right? But if you get vaccinated, maybe less severe symptoms.
That's exactly right, Kafi. That and nothing is 100%. Nothing that exists in the medical world is 100% protective towards preventing disease. Unfortunately, there's some things that come close, but part of preventing flu, and flu is a serious illness. So I think we've maybe lost the emphasis here with this COVID-19 pandemic. And the last thing I want to do is put more stress on people. But influenza is a serious, serious illness, and that anything that you can do to protect yourself and your loved ones from this virus is absolutely vital. One, because the last thing you want to do is be exposed to two viruses at once, COVID-19 and flu. But number two, just because the vaccine itself is not 100% effective does not mean it's not going to connote protection to you. You are going to benefit from this vaccine in some ways. Either it's going to completely, you're going to be one of the people in which you're actually protected. You're not going to get the virus because you got the vaccine. Or if you got the virus and you unfortunately got infected, you're likely to have vastly diminished symptoms, much more milder symptoms because you got the vaccine. So it's a beneficial thing to do regardless.
Yeah, and we're dropping a resource in right now that lists the steps you can take to protect yourself and your loved ones from flu. Dr. Gupta, we've talked a lot about flu shots, but can you talk a little bit more about some of the other ways people can protect themselves from flu?
You bet. I have a lot of props here, but I guess I'll prevent doing that right now. This is what I'll say. The best things, a lot of the things that are best practices to preventing infection with any respiratory virus like flu, we've already been messaging on for the last 9 months. So I love the fact that the message on masks is widespread, because here's the thing. That actually, I'm not sure if this is going to be a way of life moving forward, but masks, especially 3-ply surgical masks like these guys, are actually very effective at diminishing transmission or exposure to respiratory virus droplets like flu. So this is one way right now, while you're protecting yourself from COVID-19, this is going to have positive effects from protecting yourself from influenza. Hand hygiene, absolutely vital. We know that respiratory viruses exist on skin for hours. COVID-19, it can exist on your skin for up to 9 hours. It's kind of scary. So having a hand sanitizer handy with at least 65% or greater ethyl alcohol, ethanol in that ingredient label, you want to make sure you have that hand sanitizer that says at least 65% or greater ethyl alcohol, or otherwise known as ethanol, in the product insert. That can be helpful. Or soap and water for 20 seconds. That's also vital. I've gone to the extreme here because I think we're unfortunately, we're sort of in a health disaster right now. I don't think this necessarily it needs to be the way of life forever, but right now, given what's happening, I think people want actionable advice. Get yourself eye shields or a face shield if you're 55 and older. Based on some of the emerging data, that's going to help protect you against any respiratory virus, in addition to masking and in addition to other infection control measures. Here's the thing about flu that's different from COVID-19. We think COVID-19 transmits itself. Let's say if I was infected with COVID-19 and there's greater than a 50% chance that I would be asymptomatic. That's one. If I was infected, let's say I was infected 2 days ago, and now sort of the test turns up positive. I would be in most infectious right around the time when that test turns positive in COVID-19, sort of at the height of right as the virus is incubating in my body and the test goes from negative to positive. Even if I'm not having any symptoms, sort of early on in the course of infection is when COVID-19 is when I would be most infectious and harmful to others. It doesn't make a lot of sense. I'm not feeling any symptoms, and I'm just having that positive test. I was recently exposed, and here I am being very harmful to others, very infectious to everybody else. I can easily transmit the disease. With influenza, it's a little different. We think that if you got exposed on day 0, we are likely to start developing symptoms, say 5 to 7 days after that initial exposure. So there's that long incubation period, up to a week in some cases. But that you're most infectious to others when you're symptomatic with influenza. So there's that critical difference. It's why that this goes to my 4th point here. So, obviously masking right now in our current environment, great hand hygiene, face shields if you meet a certain age cutoff, if you have a pre-existing condition. I don't think there's any harm to it and maybe some potential benefit. But then if you're symptomatic, all this information is muddied because we're dealing with a respiratory pandemic right now, so forgive me. But what I will say is, if you're symptomatic and you don't, let's say you tested negative for COVID-19, there's a chance you might have the flu. And right. if you didn't get tested for the flu, you have to assume that maybe you have one or the other if you don't have access to any tests. But then you should be isolating yourself from other people, because you're most infectious if you have flu when you're symptomatic.
That face shield recommendation that you've been making, it's been getting a lot of attention, and I just want to quickly ask about it. Is that because of a situational thing for people 55 and older? What's the difference there with adding that in addition to definitely wearing a mask?
Well, so this is where, in the setting of so much scientific uncertainty and frankly miscommunication, disinformation, the questions I get are like, what can we do when there's no therapeutic or vaccine immediately available right now? Now there's a vaccine, it's still going to take some time, and we're having a catastrophic situation in hospitals. What I tell people is there's a few studies, one that was published, and I'm happy to share it to all your viewers. If you can share it to via your listserv. It was actually of community health workers in India who were going door to door providing care to patients that for a variety of, it wasn't necessarily just COVID-19 care, but just routine health checks. And they were wearing masks. They were doing all the right things. But there was a group that wore masks plus face shields or some type of eye shield like this. And then there was a group who just did everything but eye protection. And while there was not a lot of transmission in the group that did not wear eye shields and did everything else, there was still some transmission of COVID-19. And once you added the face shield component or the eye shield component, there was none. No transmission occurred. So and the group that did everything plus shielding, they had 0 cases of COVID-19. There was no transmission from, say, patient and that they were visiting at home to the community health worker. But those who didn't wear the face shield, there was some transmission. I can get the specific numbers are in the paper. I can share that paper. It was published in a very high quality journal. There's similar studies suggesting that sort of added incremental benefit to face shields, that when added on top of everything else, it can be helpful. I don't make a broad recommendation to everybody in the platforms that I have, because I think that there's only going to be an appetite. There's only going to be an appetite to do so much in the American public. So I try to target my advice to those who I think would have a bad outcome if they were infected with COVID-19. So that's why I think high risk groups, those who are 55 and older, if you have a pre-existing condition, why not try everything in the toolkit that we think might be helpful? Is the ethos there? But we do think that mucous membranes, like the mucous membranes that surround the eye, might be potential portals of entry for this virus, and it does seem like there is some efficacy to it. So I'm just trying to empower people to do whatever they can to protect themselves.
Yeah, I've actually been wearing construction glasses in certain places. I think it looks really cute, but anyway, I want to move on to talking about the COVID-19 vaccines. There's a lot going on with this right now as we speak. And do you have any more insight or into what's happening with approval here in the US and how soon people can have access to it?
I've had extensive discussions just in a few days with Moderna and Pfizer representatives, so I do feel fairly up to speed. There's an independent advisory a meeting of vaccine experts that's happening as we speak, so it's happened. That meeting is happening today, and then the CDC and other representatives from various health agencies are meeting on Friday and Sunday to really determine whether an emergency use authorization will be issued for the Pfizer vaccine, maybe as early as Sunday. This is me just speaking candidly as somebody observing all of this. I would be absolutely shocked if there was not an emergency use authorization issued for Pfizer's vaccine on Sunday or Monday at the latest. One, there's enormous pressure to do it because it's being approved elsewhere. So there would have to be a really good reason why we decided not to provide authorization while those other countries did. And I don't think there is one. We know that this vaccine is broadly safe, with some exceptions, which I'll talk about. And we know it's very effective. And it's very effective for individuals who are like if you have asthma, or if you're older with asthma in particular, but if you have a pre-existing illness or if you're an older individual without a pre-existing illness, we know that these vaccines prevent severe infection with COVID-19. It's the outcome we were all hoping for, and it's doing that. What's the concern? The concern is that, well, there's two individuals, healthcare workers in the United Kingdom, who had an anaphylactoid, and that's the technical jargon, type reaction, a severe allergic reaction, in other words, to this virus, and needed to be in a monitored setting. They needed to get things like an epinephrine injection to overcome whatever adverse events they were experiencing. I don't think there's anybody who would say that that's not something that should give regulators pause. So one, we need to better understand what actually happened. Was it related to the Pfizer vaccine? Seems like it was. Better characterize what are those two individuals' history. It was reported that those two individuals had a history of severe allergic reactions to other medications, not necessarily vaccines, but they are individuals that have EpiPens on their body at all times. So it goes back to what I said earlier when we were talking about the egg allergy piece, that if you're somebody that has any type of allergy, and again, this is maybe not on some website here that I can cite, just like the face shield recommendation is not, but this is, to me, is sort of falls in the lane of common sense and what I would tell my mom to do or my other loved ones to do, that if you've had an allergy to anything that's significant, cause wheezing, cause shortness of breath, cause your throat to swell up, cause hives, any of those to me are pretty significant. You should be getting any type of shot, whether it's the flu shot or the COVID-19 shot, in a place where you can get medical care if you need it. Full stop. And I have no doubt that that's going to be part of the product insert for COVID-19, for this COVID-19 vaccine, that they will make the exception to say that if you've had a history of severe allergic events in the past to any type of medication, or potentially even to food, I'm not totally sure what they're going to say, that you should be getting this vaccine in the care of a physician, not at your supermarket or your drugstore. So that is going to be the exception, I suspect, but I have no doubt that there will be an emergency use authorization. We've been told that we'll be getting the vaccines in our ICUs as early as middle of next week. I'll be taking mine on air on the Today Show, so I look forward to that, and I look forward to others leading by example. And I think all of us in our local communities need to be leading by example and getting the vaccine visibly and reporting on how we're feeling, so people get comfortable that this is a safe vaccine because we know it's an effective vaccine, and the quicker all of us get access to it and get vaccinated, the quicker we can start planning that vacation that we all want to go on. But I would say Moderna's vaccine is going to likely get an emergency use authorization by the end of the following week. We know that there's probably 4 other candidate vaccines in the pipeline that will get emergency use authorization in the turn of the calendar year. So we're not going to be rationing vaccines and access to them as much as we are right now. And I suspect the general population will be getting access to vaccines in the March-April timeframe. And if people get vaccinated when they start having access and comply if there is a second dose, in basically all cases aside from the Johnson & Johnson vaccine, you need to get a second dose about 21 to 28 days later. Presuming everybody just does as indicated, and if you've had that severe allergic response in the past to something, doing it in a monitored setting with your doc or your provider. With those exceptions, let's say we all do it, at least 70% of Americans do it, then I think we can start to talk about normalcy by the summertime and hopefully midsummer.
Yeah, you're leading by example. Brings me to our little buzzword slide here, and questions around the vaccines and the pace in which they were developed, right? Record speed, or at least the clinical trials happened in record speed. And a lot of people have questions about that, and it's giving some people pause. So what do you say about that? And what would you try to explain to people to maybe not have as much pause?
I would not focus too much on the fact that it's taken only 10 months to develop this vaccine, because while that is the case and it's a scientific feat, the circumstances here are incredibly unusual. Mm-hmm. And so if we, in theory, it's not like this couldn't have been done in the past for other viruses. We just didn't have the entire world and every scientific company in the vaccine space and every government funding this and so focused on this one singular effort. So I think a lot of the attention has been on speed, but the fact here is that we've never had such a focus on one singular achievement as we've had with the COVID-19 vaccine across the world. Best people focus on this one single effort. So I think, and regulators have complied with loosening, loosening deadlines, making sure that they were available, and but making sure that the strictest scientific protocols were adhered to. That they didn't cut corners in any way when it came to looking at the data and making sure that what's safe is safe, what's not safe needs further investigation or needs to be completely removed. Yeah, that's what we're seeing here. We saw lots of pauses, regulatory pauses on the part of pharmaceutical companies who said, you know what, wait, we had an adverse event, let's exonerate what's actually happening. So I think there's been too much of a focus on the disinformation that's been happening over the last 9 months. There's been too much of a focus on politics getting into, or the concern about politics actually driving what's happening here, not science. And fundamentally, I think we're going to have independent experts in the next 2 days look at the data, and they have nothing to gain and everything to lose by rendering a judgment that isn't based in, fully in science. They would lose their reputations. They have nothing to gain financially or politically. This is all about science.
Do we know yet if the vaccine, the COVID-19 vaccine or vaccines, will operate kind of like the flu shot where you have to get it annually, or do we know if it's something that might give us lifetime protection?
I guess I can concisely say no. We don't know that. I know the physician leading the Operation Warp Speed effort claimed a few days ago that perhaps there's 2 to 3 years worth of protection. Most, at least what I've seen and what my colleagues have seen, I think the big answer is, well, we just don't know, because all the phase 3 trials are only about 3 months out. So how can we claim to know what's going to happen? How can we claim to have that knowledge when all these studies are only 3 months in flight. I think there's going to be at least a year's worth of protection based on the antibodies that are the level of antibody that's being produced to these vaccines. But to suggest that it's going to be up to 2 to 3 years, I think this is gross speculation. And it's going to be really vital, Kafi, let me just say this, for us to acknowledge what we don't know and to be upfront about that. So the duration of protection is an open question, but I would be surprised if it's not at least a year.
Yeah, I want to move to the next slide and talk about the fact that the Centers for Disease Control and Prevention list, otherwise known as the CDC, lists people with asthma as being possibly at higher risk for getting COVID-19. But the current evidence shows people with asthma are not more likely to get COVID-19 or have more serious symptoms or worse outcomes than people without asthma. But respiratory infections can be challenging for people with asthma, and COVID-19 is definitely not an exception. Chris from Wisconsin wants to know, will people with asthma be considered in the high risk category and be eligible for the vaccine before the general public? And has it been tested in people with asthma?
Well, I certainly hope so. I do think that there is this notion, some data from some studies suggests that those with asthma are actually protected from infection with COVID-19. And we're still trying to understand the biological underpinning. And there's been many hypotheses put out there for why that might be the case. While that might be an interesting scientific pursuit, I think it would be a mistake if asthmatics were not included in the very high risk group of individuals who need priority access to the COVID-19 vaccine. There's so much we don't know. There's still so much uncertainty about this virus and this disease. These studies are happening, have been conducted in just the span of a few months. They're not definitive by any means. So yes, I do believe that the Advisory Committee on Immunization Practices has very good reason to put asthmatics in a high risk group, and if they haven't already. And so I can imagine once we get past Tier 1A and move into Tier 1B and sort of the following phases, that asthmatics will be prioritized, absolutely. And from at least my discussions with individuals who are sitting on that committee.
Got it, that's so helpful. Let's talk more about the steps people with asthma want to know, or talk more about the steps people with asthma want to know how to best manage their asthma during the pandemic and flu season. Jasmine asks, how do I best care for myself and prevent others around me from getting sick when I have to go to frequent doctor's appointments during cold and flu season?
So I mean, Jasmine, I think it's going to sound like a broken record here, but everything that you're doing to protect yourself from COVID-19 right now, or that we've been preaching, are the things that you can control. I would say the things that you can control that are quality of mask. So making sure that you have the best fitting mask possible, but that the components of that mask are either a three-ply mask of some variety, either these blue masks that you can get from any department store or drugstore, or a thick cloth mask with multiple layers. So you want to make sure that is the key focus there if you're an asthmatic. Everything I mentioned about infection control, so good hand hygiene. I would face shield, frankly, if I were you, especially when you're going out to other doctors' offices. Maintaining your distance, absolutely vital. And then this might seem silly to say for individuals who have long-term asthma, but making sure that you're following your asthma control questionnaire or whatever it is that you use to monitor your symptoms, and making sure that you're in that well-controlled category. We know that people who have poorly controlled asthma at baseline, where they're having symptoms at nighttime awakenings, they're getting gas walking down the street, walking their dog, you name it, that those individuals are at higher risk of ending up at the hospital by definition, pandemic, no pandemic, but that they're also more susceptible to coming down with an infection like one from flu or one from COVID-19, that you're just by definition less prepared to defend or fend off that type of virus. So the better controlled you are, the better you're able to move air in and out of your lungs, the better you're able to fend off COVID-19 or influenza should it try to infect you.
Yeah, Dr. Gupta, you just queued up our next resource slide like magic. And this is a good time to highlight one of the most important things everyone can do to keep their asthma well managed, and that's to have a written asthma action plan. And this plan provides information and instructions on how you can manage your asthma. And AFA's asthma action plan is available in English and in Spanish, and you can download copies for you or your child's doctor to fill out at aafa.org/action plan. We also have another key resource with everyone spending more time indoors at home. It's important to make sure you have a good air ventilation and a healthy indoor air quality. Our Healthy Homes checklist can help, and you can scroll over the different rooms in the house to get tips for each room, or can download a printable checklist at afa.org/healthy-home, or that's aafa.org/healthy-home. And I want to also move on next to another huge topic for the community, and that's COVID-19 in schools. School nurses are on the front lines of providing care for children during the pandemic. I giggled a little bit there because it seems like we've moved on a bit from this topic from COVID-19 in schools, but it's still so present for so many people. So an important question from Stacy in Washington is, how can school nurses best support students with asthma during COVID-19?
Stacey, it's a really important question. I'm going to try to prevent myself from rehashing everything I just said on infection control. So assuming we're starting from that same baseline of masking, distancing, great hand hygiene as sort of the core of our COVID-19 mitigation response, what else can you do? I would actually encourage school nurses to make sure that their young students are doing a peak flow with some degree of frequency, because then that will tell you and signal, oh, is something up? Is something happening here that's an early sign that, you
broke up a little bit.
Test for either flu or for COVID-19 or a respiratory virus panel if they really need it. Is something happening there? So I think that to me is one thought. I would just quickly say, because I know a lot of parents out there are worried about this, there is now a growing consensus that, especially in our elementary school students and younger, that these are individuals that tend to not demonstrate severe manifestations of COVID-19 if infected, and then importantly, they don't seem to easily transmit the disease to adults. So it's really good to see that elementary schools are opening up across the country, even though it seems like there's some cognitive dissonance and with the pandemic getting worse, that we're encouraging this. It looks like the data bears itself out that it's actually not a harmful thing when it comes to pandemic control, and it's obviously a really good thing for the students' well-being to be in the school setting. But that's what I would recommend. Monitoring, surveilling symptoms in addition to through a peak flow, in addition to all the common interventions.
This is such a good and useful discussion. We are actually coming up on the hour, so what we want to do now is just drop in another quick reference here for our audience that AFA has a respiratory symptom chart. It's an easy to use quick reference to help school nurses, parents, and others identify which condition may be causing the symptoms. This includes asthma, flu, the common cold, allergies, and COVID-19. It's available also as a free download in English and Spanish. We also have another great resource. It's AFA's COVID-19 and Asthma Toolkit for Schools. This is a comprehensive toolkit that includes checklists for school nurses, facility staff, teachers, and administrators to help manage asthma in the school setting while reducing the spread of COVID-19. Well, Dr. Gupta, thank you so much for joining us, and thanks so much for your time. We really appreciate it. Can't tell you how much. We appreciate everything that you're doing to take care of people with COVID-19, especially as you head right now from this to the ICU. Now, we're also encouraging everyone that is watching this chat to stay engaged and to continue this discussion and finding updated resources through our online community. We'll continue to share recent news about COVID-19 and the flu. so you have information you need to take care of yourselves and have important conversations with your doctor or doctors. If you send in a question today that hasn't been answered, we'll try to answer it as soon as we can. We encourage you to sign up for AFA's community for tips to help manage your asthma and allergies. Make sure to go to aafa.org/join. You can opt in to get involved. You can advocate for people affected by asthma disparities, participate in patient-centered research and clinical trials, or join our Patient and Family Advisory Council. Thank you so much again, Dr. Gupta. Thank you so much. Yeah, I'm Kafi Drexel Brown with the Asthma and Allergy Foundation of America, and thanks everybody for joining in.